Thank you so much for watching On Call for All Kids. Today we're talking about preparing for your child's surgery. We'll be discussing the process of scheduling an operation, the protocol on COVID testing prior to surgery, and what you and your child should expect before and after the surgery. I am joined by Dr. Raquel Gonzalez. She is a pediatric and surgical critical care surgeon here at Johns Hopkins All Children's Hospital. So happy to have you here, Dr. Gonzalez.
Ashley, thank you so much for having me. It's an honor to be here.
Now, sometimes our children have to have a surgery and it's for their benefit, but nonetheless, that can be scary for parents. So, we're really glad to have you here and kind of walk us through tips and advice to ease parents' fears when they have to go through something like this. Can you go ahead and tell us what do we expect several days prior to our child's operation?
Absolutely. So, several days prior to the surgery, our pre admission team will actually get a hold of the family and start giving instructions on what to expect. The most important thing is when should the child stop eating or drinking? And we call that NPO. And we do that because we want to make sure that the process of going to sleep under general anesthesia is actually very safe. So, in general, the adequate time frame would be to stop eating or drinking at about 8 hours. Now, there's times that we will vary that based on the age of the child, but in general, that's the safest time frame. Sometimes we're allowed to have clear liquids, which we actually term them see-through substances. So things that we can see through, such as apple juice or jello, those will be allowed up to 3 hours prior to the operation.
And how about COVID testing? Are the parent and the child both required to get tested prior to the surgery?
That's a great question. Yes. The parent is not required to undergo COVID testing. However, our patient undergoing the operation will have to do so, and it's a within a specific time frame. So we have 3 days within the operation to get that COVID testing. The pre-admission testing team will facilitate that, and it can be done at our facility, but also it can be done at the facility of choice of the parent. The important thing is that if it's done at another facility, we as a team have to receive that result within 24 hours prior to that operation so that we know the status.
Now, on the day of the operation, what should the parents and child bring with them to the hospital?
Okay. The child an empty stomach, of course, right? But for the parent an ID to allow us to identify you as the parent of the child. And also, I always like to kind of suggest a little sweater. It gets a little chilly in here, and so having a sweater will help. If the parent knows that the surgery is scheduled for a prolonged time, a book might be helpful. One of the new features that we have with our EMR, we call it Epic, is the ability for parents to sign up during registration to receive secure messages while the patient in the recovery room. And it just allows the nursing team to send quick snapshots of you're doing okay, everything's going well, we finished the operation. And so that helps alleviate the parent as well, but they have to sign up for that.
And then lastly, Dr. Gonzalez, how as parents do we speak to our child about what they should anticipate after this surgery?
Absolutely, great question, right? One of the most important things that I'd like to convey is that surgery is a team sport. So the parent is not alone in trying to ease the child. We in the clinic start the process by explaining to the parent and the child. Sometimes the parents have to reiterate a little bit of information at home to ease the child. But once the patient gets here during the perioperative assessment, we too start reiterating that, helping with the perioperative team members. We have a wonderful team of child life specialists that are specifically trained to help us in delivering that information. And they use resources such as books and toys to help ease the child. So it's very important if the family understands that they're not alone. We're here to help and make this process as smooth as possible.
Great. Dr. Gonzalez, thank you so much for joining us today and kind of helping parents ease those fears about surgery day if and when their child does have to go through that. We appreciate you.
Absolutely. Thanks for having me. It was a pleasure being here. Thank you. Have a great day.
And thank you all so much for watching. Don't forget, you can also visit our website. It's hopkinsallchildrens.org/newsroom. There you'll find a lot of great topics in pediatric healthcare and other wonderful resources for your family. We'll see you next week.